All right, thank you, Kimmy. Well, folks have been signing up, or at least trying to sign up, for the new health care offered by the Obama administration here for, what, a little over a week now? And the numbers vary widely depending on who you talk to as to how many are actually signed up, how many people have tried. Well, we brought our insurance expert, Craig Gusson, in here once again this morning to kind of update us on the costs and the signups. Now, I want to have a candid discussion about the signups first off, because I don't know whose numbers to believe. They can't both be right. You know, one side tells you nobody's signed up, and the other side says 1 million have signed up so far. You're the insurance expert. You're the one actually signing people up here in California and offering these plans. How many agents around the state?
About 13,000 that have signed up to want to be in the exchange, to be able to be certified to sell those products in the exchange.
13,000 agents
have tried to sign up. Of that, maybe 5% have been certified, and the rest are just waiting. Same issue we're having with trying to get, people going online. All these problems that they're having.
So the agents have not even been able to get signed up to be certified to sell the product.
Exactly.
Only 5% of the agents that have tried.
Maybe 5.
Maybe.
Yeah.
Do you have any sense of how many individuals that have gone online and signed on themselves have actually been successful?
You hear the stories all over, and there was a quote by Congressman Buck McKeon from LA, and he said he thinks less than 10 people, which I think is a little low, but I don't think the numbers are as high as you're hearing. I will tell you, I was trying to help a client in New York, and I went on their website, and their website compared to California's is terrible. So I just think, again, it's what I've been saying since day one. You got to just take a step back, and you got to realize we have a lot of time. We don't have, see, what people don't realize is you can buy policies in the exchange or outside the exchange. The companies selling outside the exchange are the same ones inside the exchange, plus Cigna and a couple others. Most of those rates haven't been published yet, and you can probably save money. The only people going into the exchange should be people that are getting subsidies. If you're not getting a subsidy at all, and we're going to talk about that in a couple minutes, then you want to definitely look outside the exchange and see if you can get a better plan and save money.
Perfect. Now that's news that people can use this morning. If you're not insured through your employer, if you buy your insurance yourself, if you are eligible for a subsidy, look at the exchange. If you're not eligible, look at the exchange and outside the exchange as well. Expand your search for health care coverage. Perfect. That's good. That piece of information we can pass on to everybody. All right, let's talk costs here. What you're seeing so far. Now you've got some numbers set for me this morning. I was scratching my head going, I don't know what these mean.
Basically what it means is that between age 25 and 45, buying a policy in 2013 and buying a policy in 2014, the rates have doubled for very similar coverage. So you're going to pay more money. That's without a subsidy. When you dump the subsidy inside it, then it starts getting a benefit. So if you're making $28,000 to $35,000 a year and you're 25 to age 40, you're going to get some subsidy benefits. But after age 40, it really reduces a lot. If you age 50 to age 64, you're going to get great subsidies in that, because the more money you have to pay for health insurance, the bigger the subsidy, to a point where you're paying $1 a month if you're age 63 for the bronze plan. So there are some great subsidies. However, those people are going, okay, what's my copay? $60. I can't afford it. What's my deductible? $5,000. I can't afford it. Again, the more subsidy you get, your deductible in some plans will come down. But again, it's the education process. You got to look and see what's out there. If you're getting a big subsidy, you definitely want to be in the exchange. If the subsidy is really small, I would also look outside the exchange to see if rates are maybe less and benefits are better.
We've got to wrap it up here, but what about seniors signing up?
Seniors, October 15th through December 7th, seniors can sign up like they do every year, or anybody who gets Medicare, because you could be under 65 and still have Medicare. If you do, you're going to want to check your plan, especially if you have a Medicare Advantage or the prescription Part D plan, because the plans change a little bit, the co-pays change a little bit, and also what you pay for it. And if you're taking a prescription or a brand new prescription, you're going to want to make sure that the new Part D prescription plan covers it and is still on the the list of drugs. And you're going to want to, again, talk to your agent, go through it, and make sure that it's, that you have the right plan for you.
All right, producer Maria is going to kill me for asking one more question, but I think it's really important. Is there any reason why you should not go to an agent? I mean, does it cost you any extra money to go through an agent and get professional advice?
The cost is the same. If you're spending $300 a month, it's $300 a month using an agent or not using an agent. What is going to give you our expertise? And that's why people come to me all the time and say, help me. Even the Medicare. I don't explain this. I get all these, I turn 65, I get these books that are this big going, what does all this mean? So you need someone to walk through and say, what are you trying to accomplish? What's your concerns? And we can help you either for somebody who's getting Medicare or somebody going through the exchange.
All right. Craig Gusson, great to see you as always.
Good to see you.
I'm sure we'll talk to you next week and get another update. Thank you,
good.
sir. All right.